trigeminal nerve. So which in supercellular artery? So trigeminal, which muscle is most likely involved? Superior cerebellar artery. Trigeminal, which vessel is most likely involved? Superior cerebellar artery. It goes in the foramen rotundum. Question number, both of them go. Question number 38. Diagnosis of carotid artery dissection. Which segment of carotid artery is most likely to be involved? Cervical segment. In carotid artery dissection, most likely segment involved cervical segment. C for carotid artery dissection, C for cervical segment involved. Question number 39. Angiogram shows occlusive disease in the left subclavian artery origin. Okay, again this is a carotid artery dissection, cervical segment involved. This is carotid artery aneurysm. This is parotid gland tumor, and this is pleomorphic adenoma. Question number 39. Angiogram of occlusive disease in the left subclavian artery origin with fluorouracil in the epilateral vertebral artery on delayed images. What is the appropriate treatment and vascular stent placement? Angiogram of occlusive disease in the left subclavian artery origin with fluorouracil in the epilateral vertebral artery on delayed images. Appropriate treatment and vascular stent placement. When there is occlusive disease in the left subclavian artery and there is fluorouracil in the vertebral artery, then what is treatment and vascular stent placement? Question 40. A 25-year-old homosexual man penis swelling of his parotid gland and MRI was performed. What do we expect to see? Multiple bilateral small cysts within both parotid glands. Now this patient has HIV and then he has penis swelling of his parotid. So in HIV parotitis, there will be multiple bilateral small cysts within both parotid glands. In HIV parotitis, there will be multiple bilateral small cysts within both parotid glands. Question 41. MRI shows atrophy of the cervical spinal cord without evidence of cerebellar atrophy, mostly diagnosed by ataxia. Please also memorize this, that when the atrophy of the cervical spinal cord without evidence of cerebellar atrophy, mostly diagnosed by ataxia. Okay, by ataxia involves cerebellar atrophy, and it involves cervical spinal cord atrophy, but no cerebellar atrophy. So by ataxia. Question number 42. 15-month-old child CT scan age 6 months was normal. CT scan showed defect in the right temporal bone with indistinct scallop margin, defect in the right temporal bone with indistinct scallop margin, and prominent CSF space lying adjacent to it. Usually there is prominent CSF space lying adjacent to it, defect in the right temporal bone, scallop margin, and prominent CSF space lying adjacent to it. Where the right temporal encephalomalacia was most likely diagnosed leptomeningeal cyst. Its other name is cyst groin. Leptomeningeal cyst. Another name is groin skull fracture. Groin skull fracture, leptomeningeal cyst. So look, the patient has a scalp fracture, and then there is prominent CSF space lying adjacent to it, so leptomeningeal cyst. This skull fracture diagnosis, the pneumocephalus, the leptomeningeal cyst, with CSF space, prominent CSF space, and this CSF rhinorrhea in the front. And 43. CT scan shows crescent-shaped axial mixed collection was seen. What other pathology was most likely to hint the diagnosis? Metaphyseal coronal vector rotibia. The child who has crescent-shaped axial mixed density which has subdural hematoma, which is a non-accidental injury. So what other non-accidental injury will you suspect? Metaphyseal coronal fracture of the tibia. Correct? Non-accidental injury is which one? Subdural hematoma and metaphyseal coronal fracture of the tibia. Question 44. Facial CT scan shows a bony septum extending across the posterior choanae. Real additional findings are likely to be seen. Thickening of the vomer. Cause of choanal atresia. Okay. When a facial CT scan, there is a bony septum extending across the posterior choanae, then this means there is choanal atresia. Diagnosed choanal atresia. And in the choanal atresia, additional features are thickening of the vomer is also seen. When there is a CT scan, the bony septum extending across the posterior choanae, the diagnosis is choanal atresia. In choanal atresia, we can see thickening of the vomer also. Question 45. HIV positive female with a CD4 count of 40 cells. MRI demonstrated bilateral asymmetrical patchy white matter change, mostly diagnosed progressive multilocal focal recurrent encephalopathy. This progressive multifocal leukoencephalopathy. MRI demonstrates bilateral or unilateral here, asymmetrical white matter changes, bullseye diagnosis, progressive multifocal leukoencephalopathy. At every positive female CD4 count of 40 cells, MRI demonstrates bilateral, asymmetrical, or right side asymmetrical patchy white matter changes, bullseye diagnosis, progressive multifocal leukoencephalopathy. Question number 46. What feature makes the diagnosis of toxoplasmosis more likely than lymphoma? Hemorrhage on CT. On toxoplasmosis, there may be seen hemorrhage. What feature makes diagnosis of toxoplasmosis more likely than lymphoma? Hemorrhage on CT. Toxoplasmosis is more likely hemorrhage on CT. Question 47. 4-year-old boy with short stature and diabetes. CT scan shows downward cystic mass with some peripheral calcification. Downward cystic mass with some peripheral calcification in the suprasellar region with peripheral enhancement on contrast. Diagnosis craniopharyngioma. 4-year-old boy with the pituitary macroadenoma, craniopharyngioma, ICA aneurysm. Pituitary macroadenoma, craniopharyngioma, right ICA aneurysm. So, a 4-year-old boy with stature and diabetes sees round cystic solid mass with peripheral calcification in suprasellar system. Diagnosis craniopharyngioma. Question 48. 35-year-old man with CT scans of 5 and 6 cm cystic soil mass with heavy nodular calcification, oligodendroglioma. Tumor extended to the cortical surface with associated erosion of the clavarium. Extended cortical surface with erosion of the clavarium. Diagnosis oligodendroglioma. No, very large cystic soil mass with heavy nodular calcification, oligodendroglioma. This is pilocytic astrocytoma enhancing mural nodule. ये बेटा अभी लेक्चर बंद रहेगा. Oligodendroglioma, pilocytic astrocytoma, heavy calcification, and oligodendroglioma.